Hi everybody, I'm Dr. Laina.
I'm Dr. Jamie.
And today we are going to demonstrate 3 different ways to stretch out the front of your hip, your psoas, the front of your abs, the front of your thigh. So basically your groin muscles.
Hip flexors.
Your hip flexors, thank you.
You're welcome.
So these muscles get exceptionally tight, especially when you sit for long periods of time. You can see how ours are getting pinched just sitting here. So it's really important to open them up. By the same token, when we open them up, we want to try to avoid injuring the delicate structures of our low back, which a lot of people will do these wrong and they'll extend their back and cause themselves more harm than good. So we're going to show you some really easy ways to get these stretched out. So I'm going to have Dr. Neely help me out. So the first one, we're just going to have you find, even a bed is a great thing to do this on. And all that Dr. Jamie's going to do is he's just going to lie down on his back. Yep. And then he's just going to have his legs hang off the end of the bed. And for most people, their feet won't touch the ground because we're on our chiropractic table. His feet are touching the ground. But a lot of people will feel a nice, gentle opening in the front of their body and through that area, just lying in this position. I've had patients who think this stretch has changed their life because just this gentle way of opening has gotten rid of some of that chronic pain they have in the front of their body. It's also a very comfortable position to lie in, as you can see, for a couple minutes anyway. You don't have to get into it the way that Dr. Jamie did by lying backwards. If that's too hard for you, you can just scoot yourself down the bed until your feet hang off the end of the bed. If you want to increase the stretch, you could put one or both arms above your head and just let them hang there. You can put them on a pillow up here if that's more comfortable, and you'll really notice that that will increase the stretch. So I'll have you sit up for me, please. And now we're going to show you. So that's the easiest way to do it, the gentlest way to do it. For many people, that's all they need. But we'll show you 2 more ways of doing this. So I'm going to have you lie like full out on the bed if you can. Okay, so all that we're going to have Dr. Jamie do right now is bend both of his knees and scooch himself to one side and let that leg just gently hang off the side. Yes, exactly. So now you can see that he's getting much more stretching through this area. What's really important is that both pieces of his buttocks are still on the bed being supported, so he's not creating an arch in his low back. If this hurts your low back or creates tension in any way, it is not the stretch for you. But again, you can see he can get a little bit of a deeper stretch. Some people will even do this on a couch. And then to deepen it, if he wants, he can just straighten this leg. That'll deepen the stretch for a lot of people slightly as well. And it'll help that side let go. Very often you'll feel more tension in the groin on the side that's your handedness. So that extra reaching forward to use your mouse or something like that when you're sitting at your desk or to drive will very often cause even more crunching in through the groin area. And then last but not least, the deepest way will be to have you stand up. We'll demonstrate the right way to do a runner stretch. So I'm going to have Dr. Jamie, stand up and just get yourself into a lunge position. Yeah. So you can see when he's in the lunge position, his knee is over his ankle. He's up on his back toes. And right now he's stretching the side that's away from the camera. So we'll have him switch around in one sec, or right now. So now he's going to be stretching the left side of his body. It's completely okay to hang on for support. There's no extra benefit in trying to balance yourself except to focus on your balance. And if he wants to increase the stretch, all that he's going to do is he can bend this knee slightly. Yep. And he's going to pull. He's not going to go backwards so much as he's going to go up. He's going to sink down and lift his sternum up. So just by stretching upwards, he'll feel an increased stretch. What we don't want you to do is arch backwards because that will end up irritating the sacroiliac joint on the side that he's trying to stretch. So instead we want to create more length so that as the knee slowly goes down to the ground, the chest stays upward. And so he's got a nice great stretch on that left side of his body. If he wants to increase it, he can lift the left arm up. Yep. And if he's really a superhero, he could bend over to the right. And now he's getting a really deep stretch down that side of the body. So he would hold this stretch for about 30 seconds, relax, and then release. So this stretch you would probably only do about 2 rounds of 30 before you'd switch to the other side. The ones when you're lying on your back and they're a little bit more passive, you can hang out there for a minute or two and just let gravity release the stretch. And one of these three should very definitely get into those deep tissues and the hip flexors and in the front of the hip to ensure that you get rid of that tension that you've built up sitting all day long. So if you have any questions about any of these, please let us know. If you like this video, subscribe to our channel, press like, and we'll see you soon.